Hello again. I'm Dr. E. Barry Gordon, and this is the 7th video in my series on the disease testosterone deficiency. Testosterone. I know of no other subject in medicine that provokes such an emotionally negative reaction in so many doctors. They freeze or turn away at the mere mention of the word, appearing either panicked or angry. I've had the personal experience of having a fellow physician not only refuse to go on a radio show with me to discuss testosterone, but even advise the producer to not have me on the show at all. I came to understand that this doctor didn't believe that testosterone was a fit subject for discussion. One of the numerous unbelievable realities that orbit around this basic hormone. In this video and the next, I'm going to give you my view of why this phenomenon exists. It's important for you to know, because if you're going to deal with the disease of testosterone deficiency, this is the medical mindset you're likely to face most of the time. You really should expect it. After all, if doctors told you that they thought testosterone replacement was a good idea, they'd have to explain why they hadn't already prescribed it. As I mentioned in the previous video, this medical negativity can be so extreme and rigid that some doctors even refuse patients' requests to be tested for testosterone. This attitude especially affects women, even to the point that several of my female patients have had other physicians, unbelievably, lecture them that testosterone has nothing at all to do with women. While this is a common misconception among the general public, it's a very sorry situation where members of the medical profession seemingly regress into a state of total ignorance of basic biology and physiology. To again clear the air of that fallacy and to arm you should you hear such nonsense from anyone, here again is some of what a popular online encyclopedia says about testosterone and women. Quote, testosterone is a steroid hormone from the androgen group. In mammals, testosterone is primarily secreted in the testes of males and the ovaries of females. Quote, in both men and women, testosterone plays a key role in health and well-being as well as in sexual functioning. Quote, the following are the first visible effects of rising testosterone levels in childhood and occur in both boys and girls in puberty. Adult type body odor, increased oiliness of skin and hair, appearance of pubic and armpit hair, the adolescent growth spurt, and accelerated bone maturation. And finally, quote, adult testosterone effects are more clearly demonstrable in males than in females, but are important to both sexes. They include sexual desire and mental and physical energy. I don't think it's possible that the current medical attitude about testosterone is due to some defect in education. It must be rooted in prejudices. Prejudices so deep and powerful that these doctors close their minds to the very existence of a fundamental mammalian hormone. As I believe you will come to understand through the videos that follow, this medical frame of mind has been and continues to be responsible for the suffering and deaths of countless millions of people. So why does this negativity over testosterone exist? How did it come about? I see it having two distinct foundations: federal government policy and the news media. The government, in the form of the Federal Drug Administration, has done a good job frightening doctors away from using testosterone in either sex. I assume that for no reason I know, they fear being sued for malpractice or possibly being accused of professional misconduct. What's behind the fear of treating women for testosterone deficiency? The official blurb for the most effective and safest form of testosterone, the injectable, states that, and I'm going to leave out the trade name, quote, testosterone injection is indicated for replacement therapy in the male in conditions associated with symptoms of deficiency, close quote. The logical assumption from reading this would be that testosterone is not indicated for use in women. Is it the FDA's position that testosterone deficiency does not exist in females? More on this in a few moments. The very same blurb also states that the dosage of testosterone, in part, quote, depends upon the sex of the patient, close quote. The blurb also states that testosterone is contraindicated quote, contraindicated in pregnant women or women who may become pregnant, close quote. There's nothing stated about women in general. There's a lot of contradiction here. To confuse matters even more, there is an FDA-approved testosterone for women. It's methyl testosterone, which comes in a pill combined with an estrogen and is approved to use only for menopausal flushing when female hormone replacement alone isn't enough. A methyl testosterone, by the way, is relatively ineffective and has a significant incidence of liver toxicity. If we summarize all the official indications for testosterone, we come to understand that men can use the safe and effective form for any symptom of deficiency, but women can only use the relatively ineffective and potentially toxic form and only for severe menopausal flushing. Can the sexual bias be more obvious? And note that the FDA, by approving that two-hormone combination for women, has acknowledged that testosterone deficiency does affect females. If all this turns doctors away from treating women, what about men? There's a warning in the same blurb which very obviously would make most doctors terrified of treating men with testosterone. Quote, geriatric patients treated with androgens, that's testosterone, may be at an increased risk of developing prostatic hypertrophy and prostatic carcinoma, although conclusive evidence to support this concept is lacking, close quote. The FDA has put the words prostate cancer and testosterone in the same sentence. What more do you have to do to frighten doctors? But let's have a closer look at some of the wording in this warning statement. They say geriatric patients. Clearly, that means that the FDA considers testosterone replacement to be safe for men younger than the geriatric age group, whatever that is. And did you notice that the connection between testosterone and prostate cancer is called a concept? A concept? Is there any weaker word? There'll be 2 future videos about the relationship between testosterone and prostate cancer. But know now that many major institutions and a major governmental health agency have all completely dismissed any connection between levels of testosterone and getting prostate cancer. Nevertheless, that unwarranted official warning has been enough to frighten most of the medical profession away from even thinking about testosterone. So that's what the government has done. What about the news media? Testosterone has been a fairly popular subject in the news, magazine articles, on talk shows, and even in documentaries. The popular broadcast and print information outlets report almost exclusively on testosterone's illegal or abusive use, the sexual aspects of the hormone, or the rare supposed side effects in those taking megadoses, a subject I covered in detail in the first video. What I've seen of documentaries has focused on the basic physiology of the hormone, its effects, what it does. They mention that levels do fall, but don't even hint that anyone's health is affected. I've had a couple of personal experiences with the news media which indicate that they are just as uninformed about testosterone as the general public and a lot of doctors. A news reporter was literally stunned upon learning from me of the enormous difference between the doses of testosterone I give my patients and those taken by athletes and bodybuilders. On another occasion, I wrote an op-ed which was given to a major newspaper. They never printed it, but I was told that the editorial staff was extremely surprised to learn that a condition of testosterone deficiency even existed. This negative and uninformed press gives testosterone a sordid aura, almost as if it was illegal or used to serve prurient interests. Naturally, most doctors don't want to be associated with that image. So now you know the reasons for the medical profession's fear of testosterone. In my next video, I'll discuss the excuses you're likely to encounter when a doctor refuses to address the state of your testosterone health. I'm Dr. E. Barry Gordon. Thank you for watching.